It is Fertility Answers Live with Alice Crisci, co-founder and CEO of the Fertility Answers app, and my dear friend and colleague, Dr. Serena H. Chen, who's finally back.
Yay!
I'm so happy that you're back. I hope that you enjoyed your time off. We have a lot to cover today.
Yes.
So today's Monday Motivation is a tough topic because we need to address coronavirus as it relates to fertility. And we don't have a lot of answers. So I think today's topic is going to be motivating people to have the right conversation with their provider.
But we know some things. Yeah, I think the big thing is that we know that coronavirus is very unlikely to live in eggs or sperm. So that's good news.
That's great.
I also think that, if you've been to a high risk area, and you don't get sick, you're cleared within 14 days, which is also really good. So that's different from Zika virus, which is if you've traveled to a Zika virus area, it could take 2 to 3 months before you're cleared, even if you never have symptoms. I also think it's important to look at the relative scale of things, so that the flu is apparently already responsible this year in the United States for thousands and thousands of deaths. And really, the numbers for coronavirus are very small compared to the flu. And the flu, we have a vaccine, which we would really like everybody trying to conceive or pregnant or everybody to get the flu vaccine, because you can dramatically reduce the risk to yourself, to your children, to your family, to everybody by getting the vaccine. It's not perfect, but it really helps to reduce the flu infection and the death rate. And we worry about the flu a lot because pregnant people are one of the vulnerable populations that can die from the flu. Pregnant people don't appear to be more susceptible to death from the coronavirus. So I think that's also
a positive. I agree with that.
That's a positive.
That's a positive for our population.
We don't know for sure, but it appears that pregnant people are not necessarily more vulnerable to the coronavirus. It seems like if you're healthy and you're pregnant, you kind of are the same as everybody else.
So let's take a step back for a quick minute and let's actually remember what it was like when Zika hit and when SARS hit, because there are similarities. This isn't going to be the last virus that is.
That's true.
That this happens, where it's scary. There's a lot of misinformation. People might be blowing it out of proportion. We haven't necessarily ever seen maybe the length of time people are being quarantined for in whole cities.
Right.
And I certainly don't remember with Zika travel being shut down like this, but I might be remembering wrong. So let's back up for a second. Remember Zika, because Zika was really devastating to people who were pregnant, because we had a birth defect that was caused by that virus. And it was, correct me if I'm wrong, mosquito-borne virus.
Right. Mosquito-borne and sexually transmitted. Now, we didn't have travel shut down with Zika because people weren't really, because it was sexual transmission and mosquito-borne transmission, and the big risk was birth defects.
Right.
So it wasn't like we were going to have like a public health epidemic. If a lot of people got Zika, they would get a little bit sick, and then they would be done.
And they'd be fine.
So the issue was really more about, for reproductive people in reproduction, worried about like having a baby that could have birth defects.
So what happened to Zika?
So the Zika outbreak, the epidemic, seems to be under good control, but the risk for getting Zika if you travel to high-risk areas is still potentially there. So we still like people who are trying to conceive and pregnant to avoid travel to the Caribbean, Central America, South America, Southeast Asia, and Central Africa. And you can look on the CDC website to look at the map and see, what are the areas you shouldn't travel to. Now, the CDC map is a little bit confusing right now because you're supposed to avoid travel to the purple areas, except for the continental United States and France are purple. Those are not travel advisories. Those are mosquito advisories.
Ah, gotcha.
The
Okay.
purple areas in the rest of the world outside continental United
Okay.
States and France are travel advisories. And if you
Okay.
travel to those areas, you really should try not to get pregnant for 2 to 3 months. And the details really depend upon your particular situation. You should talk with your doctor.
Okay, so let's then jump from that to it kind of got handled. It feels a little mysterious about why it's well managed, but now let's jump to how the immune system is involved in trying to conceive and kind of what happens so that we can address just the immunity nature of trying to fight off a virus at the same time of trying to support a healthy pregnancy. How is the immune system involved when you're trying to conceive and growing a human inside your body?
It's a lot of it, it's actually a mystery, Alice, but I think that there is some evidence that pregnant women, number one, when you're pregnant, a lot of resources in your body are being taken up for the pregnancy. So you can imagine that if somebody like maybe is like some of their health resources have been taken away because they're run down or whatever, that they might not fight off an infection as well. And that's probably part of it. I'm not sure that we have something more precise than that to tell you. Like Zika is really not in that category. The Zika issue is more that the virus replicates in the placenta and then impacts the child. So
We don't have
that's a
that
that's a
data on this virus.
that's a little funky, right? But
Right.
with the flu, it just appears that pregnant women are more susceptible to serious complications of the flu. So most people get the flu, they feel horrible, horrible, horrible for a few days, but then they get better. But if the people that get the flu and end up in the hospital are people who are sick and old and immunocompromised and pregnant women. So those, we just know, and that's why there's such a strong recommendation every single year from American College of OBGYN, the WHO, the CDC, ASRM, for people that are planning to get pregnant or pregnant to get the flu shot, because we really do feel like you're high risk.
And even if you do get those things in first trimester, there's very few over-the-counter remedies, medicines, things that we can buy at CVS or Walgreens that can alleviate our symptoms too. I mean, isn't that also true? There are certain things we have to avoid during first trimester.
So I don't know that that's really true, but those things, even though you can run out to the drugstore and buy those things, we don't want you to buy those things or take those things without talking to a doctor.
Right.
So if you are feeling sick, you need to go get some real medical advice. You need to go and get examined and tested. And then the doctor basically weighs the risks and the benefits of over-the-counter and prescription medications and will tell you what's okay and what's not okay to take. Because we don't want you to take Tylenol for no reason, but if you have a high fever, the risk of the high fever is higher than the risk of Tylenol. So in that particular case, we would probably give you Tylenol. But of course, it depends. Like, what if you have a liver issue? Then we probably wouldn't give you Tylenol. So
So don't self-medicate. Don't self-medicate. Actually speak to your primary care doctor, speak to your OB, speak to your fertility specialist if you're still in the 9-week window of being taken care of by a Dr. Chen, or someone who is an REI that you're being taken care of.
Do not wing this. Don't just run out to the drugstore. Don't ask Dr. Google what to do.
Right,
talk to your doctor. Yes.
So what is your health system recommending even to healthcare providers? Because we certainly also don't want somebody who is suspected of having coronavirus. The whole 14-day quarantine is really important. We don't want them running into a sick clinic, and staying in the sick waiting room and then spreading the coronavirus everywhere. So what is your health system recommending to people?
They're recommending everybody who's coming from the high-risk places. Right now, it's China, Iran, Italy, and Korea. Those countries are on red alert now. Orange alert is Japan. Yellow alert is Hong Kong. So those, and it may change. Tomorrow it may change. So the big thing is cdc.gov. Put in the search term coronavirus or flu or Zika virus, whatever you're looking for. The CDC is doing a phenomenal job of trying to get the right information out very, very quickly. And I've been watching this. They've been changing the alerts every day
Sure.
as they're learning more.
So we
And
know that there's been a couple of reported cases that they can't trace to one of the high risk areas. And I think that's where a lot of this fear and panic come from.
right.
And right. So we also know about this virus that it lives on surfaces for a very long time.
My understanding is it's not clear that it lives on surfaces for a very long time, but that is why you really need to wash your hands frequently, because
Right.
when you are possibly touching possibly infected surfaces, and we don't know how long the virus can live around, and then you touch your eye or you touch your nose or you touch your mouth, that's how you can possibly inoculate yourself. And that is why hand washing is so important. Wearing a mask, unless you're taking care of somebody who's actively coughing on you
Right.
and has a fever, wearing a mask is really not protective. Like the CDC recommends, try to stay 6 feet away from people that are coughing, and people that are coughing or have a fever really should be staying at home or wearing a mask. But this idea of you and I going out and wearing a mask,
It's
it's
not going to
actually
do
much
anything.
better for us just to keep
Right.
washing our hands and to tell our patients, and we've been telling our patients, if you have a fever, you should stay at home. Like, even if you've never been to a high risk area,
Sure.
you have something that's
You have to stay
infectious
home.
and you shouldn't be infecting other people.
So here's something, though, I think that we have to address, and that's medical tourism in our field, because the Chinese market is virtually shut down right now for anyone who was expecting to come to the US to do an egg donor cycle, a surrogacy cycle, or an IVF cycle, which, I just find devastating, right? To consider that someone is lying in wait because of what they're dealing with this epidemic. It's really devastating to think about. And Italy now is facing the same, where folks who need IVF with PGD have to get out of Italy to do it, or something with their surrogacy cycle. I mean, how long do you think this might last? It might.
Well, the biology, and I'm not a virologist, obviously, but it does seem like the biology of these coronaviruses that they seem to do really well in cold temperatures. So it does seem like heat makes a difference. So like, boiling things and using disinfectant, and hot weather, like when the weather changes, it does seem like a lot of people believe that it's going to get better. Then obviously we don't know that for sure, but in general, coronaviruses do seem to do really well in cooler temperatures.
Cool. So heat up the body. So go ahead and douse your eggs with hot sauce, in other words, or like drink that ginger tea. I mean, how hot can you take it? Wasabi it up on your salmon sushi?
Yeah, I don't know if it's like spicy heat. I think we're talking temperature heat.
Yeah. we can't well, exercise. I mean, we can increase our core body temperature, at least temporarily. Does exercise
and I think, it's just like other viruses, like getting enough sleep, eating your vegetables, taking your vitamins, and getting regular exercise are all, they're all good ideas for staying healthy in general. I think the same applies to the virus. You do, if you see somebody coughing, stay away from them. Tell people at work, listen to me, I'm coughing.
I know, that's funny.
So the combination, so these are the, just to help you, this is the latest, just came out yesterday. Screening for coronavirus is high fever, upper or lower respiratory infection, and within 14 days travel to one of the high risk areas or contact with somebody who's been traveling to a high risk area. All people that are hospitalized with a high fever and lower or upper respiratory infection will now be screened for coronavirus, regardless of travel precautions. So the super severe people in the hospital, all of those people now, by CDC guidelines, will have to be screened for coronavirus. But if you're not in the hospital, it really is related to where have you been? Have you been to a high risk area? And again, obviously that's
Okay.
China, Iran, Italy, and I'm forgetting one. China, Iran, Italy, Korea. Those are
Great. And you
the
mentioned Hong
highest
Kong is
ones.
yellow
Then Japan and
and
Hong
Hong Kong
Kong,
are yellow.
are kind
Okay.
of on that list as well.
So my last quick question before we wrap it up, that was our alarm, so we wouldn't go over today since you and I are historically we go over, is so there are all these clinics though that cater to those international populations. So what should folks be asking before they go into their clinic, their local clinic? You know, there's lots in California who cater to the Chinese population and in New York. And
Right.
so, you know, we don't want people to panic again. You know, should they be calling up the clinic and finding out, you know, have you had any patients that have traveled within the last 14 days from these hotspot areas? You know, what are you doing about it? Is there anything specific
The
they should
thing is,
ask?
at this point, like, how do people get here from those countries? They come through the airport, and everybody coming from those areas actually is being pulled aside at the level of our airports.
Okay.
So they are, if you're
They are
coming
being
from,
quarantined.
yeah,
Okay.
they're being pulled aside and screened.
Okay.
So I feel like it's certainly reasonable for people to call their clinics and say, what are you doing about this? But I don't think you have to. I feel like it's not helpful to, like, just stay at home and worry about, like, oh, you might have
Sure.
somebody at your clinic with that. I feel like that's probably going beyond what you need to do.
Going into panic mode rather than just self reassurance and, you know, just not being.
Right.
We don't want people to panic. Now, one thing that I did want to ask, and I thought I had my last question. This is my last question. Is there's been
Okay.
a lot of talk about the medications that are manufactured in China not being able to get out of China because they have, you know, workers on lockdown. You know, people
Right.
are still whole cities that are being quarantined. Does that affect the fertility field at all? Do you know of any medications that are manufactured in China where we might see a shortage of fertility medications related to an IVF
Not that I'm
cycle?
aware of right now. Not
Okay.
that I'm aware of right now.
But if we do learn of that, we'll be the first to let everybody know. You know,
Absolutely.
we certainly
Absolutely.
don't want that to be an issue either. If somebody can't get their Clomid or metformin or you know, any of the drugs that are manufactured for hormone stimulation itself or for trigger shots, etc. So the key is treat this like any other flu season and virus. Don't treat it as anything scarier than that. You know, practice logic and reason. You know, street smarts. Don't
Yeah.
have to wear a mask because it's not protecting you anyway.
Keep
But
washing your
hand
hands.
washing a lot.
Avoid, rubbing
Sneeze
your
into
eyes,
your
touching your
arm.
face. Yep. And your nose. And just check in with the CDC.gov site. A great way to follow the CDC is actually through social media. They're very good at putting out alerts through social media.
There.
But the
We'll
CDC
include the
dot
link. We'll include the link
yeah,
below of the heat map. So
exactly. And
that
the
is pretty how we've
CDC.gov
tracking it.
site is they're excellent for all those kinds of things. So before you travel anywhere, they're very up to date on all of those things, and they are doing screening at the airports. So if
Great.
somebody fits the quarantine criteria, they're catching them at the airports. And like, just we really don't feel like the risks are super high at this point. We actually feel like the risk for getting the flu is higher. So we do want people to think about going ahead to get the vaccine.
Okay, it does sound like it. Well, we're so grateful for all your input on that. And you have such a calm presence and demeanor about it. And I think a lot of our patients are concerned and just curious. You know, how
Yes.
much of this is a consideration as they're actively trying to conceive. You can always find us on the Fertility Answers app. We had a beautiful release today that we can match you directly to providers in your area, to solutions that you need, and even clinical trials in a very visually compelling way on your app platform. It's available on iOS and Android. So check out Dr. Chen, certainly inside the platform. And we'll see you next week, same time, same place, for our Monday Motivation with Alice and Dr. Chen. Thanks, Serena.
Thank
Great
you.
to have you back.
Bye.